There's a part of the world that does not begin its day when the rest of the world does. While cities pulse, while markets open, while timelines fill with urgency and output, this region sleeps. Far to the south, across vast oceans, Oceania turns inward. Here, time moves differently, not absent, but slower, not empty, but held. Under these skies, among the oldest living cultures on Earth, night is not a pause in productivity. It is a condition for restoration. This is not a place without pressure, but one where different rhythms still persist. At the center of this landscape stands Uluru, a place of deep time, story, and continuity. Here, the boundaries between land, people, and memory are not separate. They are lived as one. In this part of the world, health has never been only biological. It is relational, cultural, environmental, and increasingly, Atlantic Fellows in Oceania are asking a new question. What does it mean to care for the brain in a world that rarely slows down?
I'm Alison Canty. My focus is on education and finding the ways to reach the people who are at the highest risk of poor brain health. Here in Oceania, I'm working with people in my local community who are affected by dementia, and I'm helping them to share their stories of life. Not only the challenges, but also where they find joy, pleasure, and hope.
Hello, I'm Funmi Akindejoye, based here in Hobart, Tasmania, and I'm currently studying the interconnections between brain health, nature connection, and art. And currently here in Tasmania, we're beginning to understand how people living with dementia connect with nature and land through participatory creative activities.
Hello, my name is Miguel Renteria, and I'm a fellow based in Brisbane. My work has to do with understanding the genetic and biological basis of neurodegeneration. I believe in medical research being more equitable, diverse, and inclusive. And even though Oceania is a continent that is geographically isolated, it is also a special place where different cultures and peoples meet, connect, and work together to build a more fair, equitable, and prosperous future.
I'm Kim-Huong from Brisbane, or Mianjin, as the First Nations people have always called it. I grew up in Vietnam after the war, where people had very little, but they had each other, and the community and closeness keep the body and minds very well. I carry that insight with me now, working in the communities and health services and teaching public health students, asking who get the resources for good brain health and who doesn't, and what can we do about it.
Hi, I'm Sarah Cullum and I'm based in Auckland, New Zealand. My work focuses on the interethnic differences in brain health. But here in New Zealand, I've learned about the tremendous importance of family, community, and a sense of belonging. And it makes me think that maybe brain health isn't about trying to do more, but is actually about rediscovering what we've lost.
My name is Muthoni Gichu. I am studying brain health and aging. I am always reminded that memory concerns is not a normal part of aging, but more of an opportunity, a window of opportunity that we all need to explore.
Hi, I'm Susanne Röhr. I'm based in Sydney, Australia. And my work explores how the environments and conditions we live in shape lifestyle and brain health across the life course. And here in Oceania, we are learning how connection to place, to nature, to rhythms, and to ourselves are strong protective factors for brain health, really showing us that restoration and groundedness are just as important as performance for our brain health.
Across Oceania, we explore a different set of strengths, quieter ones, time that allows recovery, cultures that center connection, environments that remind us that the brain is not separate from the world it inhabits. In an era defined by acceleration, these may be among the most important resources we have. As the world continues to perform, to produce, and to optimize, Oceania may offer a different lens. At the 10-year mark of the Global Brain Health Institute, Aussie fellows come together not to accelerate, but to listen, to explore what quiet strengths this part of the world brings to brain health, and to ask what the rest of the world might learn from the Oceania night.